Smart Care. Sustainable health for the future.
I'm here in Cardiff in the UK to discuss one of the key new trends in healthcare, what's known as shared decision-making, the process of patients and doctors working together for the best outcomes. It sounds great in theory, but how do you make it work in practice? Let's get some expert advice.
We begin with a trial study to test a shared decision-making tool to improve dialogue between doctors and people on sick leave. Dr Ceri Walby, who took part, says the questionnaire-style format revealed new things about the patient.
Initial thoughts were we're not very keen on using tools. There's a lot of paperwork, it sort of bogs you down. But we agreed to trial it, and actually was quite surprised at the sort of interaction we had using it. So sometimes it would be something as simple as they didn't feel they could do any lifting or carrying, so we could write a note saying for the next month, please could they be excused from lifting or carrying things.
It might sound simple, but in fact it's rare for family doctors to have that level of insight into why a person hasn't returned to work and what could help them to return. Professor Debbie Cohen led the trial and stresses how the choice of questions a doctor asks can really improve their understanding of the patient.
The two most important questions for GPs to ask when talking to their patients about returning to work is how important is it for them to go back to work, and how confident are they that they are going to be able to achieve that. They might be very confident they could go back to work, but actually it's really not important for them. The questions you'll ask them are going to be very different than if they say, yeah, it's really, really important for me to go back to work, but you know what, I can't step outside of my door. I don't have the confidence to go outside my door.
The UK government says it wants to involve patients more in decisions about their care. But doing so is a challenge in a health system that deals with 1 million people every 36 hours and in a country in which 15 million people have a long-term health condition. And that's not the only issue.
Spending on healthcare is under pressure here in England, just as it is in many other European countries. So how do you apply the principles of shared decision-making in such a tight budgetary context? I put that question to a leading expert from the country's National Health Service.
Jeremy, nice to meet you. Hello. Nice to see you.
Alf Collins is a former family doctor with a special interest in shared decision-making.
Why would we not want to do this? Why would we not want to involve people and support people in making decisions about their health and care? It's the right thing to do. In terms of the financial climate that we're in, there's some evidence that people who indeed do share decisions about their health care tend to opt for less invasive, less expensive procedures, low risk procedures. I think the strongest argument, however, in terms of the financial case is that we really should be providing health and care services that informed patients want, rather than health and care services that we feel they should have. So that's where we should be spending our money.
Back in Cardiff, and it's clear that a shift is underway at the front line of care as the tone and content of dialogue between patient and doctor evolves.
Whereas perhaps we were very dictatorial, we would say, right, this is the treatment, this is your choice. Most decisions now, even going down to do you want painkillers or not painkillers, is involved in a shared decision making with the patient.
Another broader trial by Cardiff University of shared decision making in the field of occupational health has just begun.
Smart Care, in partnership with AbbVie.